Welcome to Surecell Medical Centers, your total rejuvenation.
Well, we all want to look younger, we want to feel younger, we all want to feel fit, we want to feel healthy. Well, I'm here at Surecell with the medical director, Peter Lewis, who's going to tell us all about stem cells and how they can help. What is a stem cell?
Well, a stem cell is a cell from your own body that's involved in the healing and regenerative process. Our job is to take the stem cells that are in your own body and put them where they're needed. We generally get the stem cells from the fat around the tummy, and we put them into the part of the body that is wearing out from old age, such as the knee. Most of our patients come in with knee pain, osteoarthritis of the knee, but we also do rotator cuff shoulders, hip joints, Achilles tendonitis, golfer's elbow and tennis elbow, all those sort of aging-related degenerative conditions.
It's not such a well-known practice, this, is it? You know, why is that? Is it sort of fairly new technology?
It is new, yes. I've been doing it for 5 years, and there have been people treating patients with stem cells for 15 years. But it's just grown a lot recently, particularly with some of the athletes that are getting the publicity, some of the movie stars and Hollywood singers, and they're getting...
They all want to look younger.
They all want to look younger, they would feel younger, and of course some of them have very demanding parts. I mean, some of the guys that are doing the fight scenes, like Mad Max, very, very physically demanding. So they need to be in top condition, and they're getting injured all the time, and we're treating them.
And as you get older, these stem cells, they don't work so well, do they?
Well, no, actually, we've just done a study looking at that. We looked at the results that we had in different age groups. It was a large study done in Australia based on patients who came to our clinic in the early part of 2014. And what we found was that even patients who are 80 years of age and more were getting results that were fairly similar to the younger patients. Really? There was about a 10% drop in the results. So across the board, we generally get about 80% of patients have a good result. But even in the patients over 80 years of age, we still had 70% were getting good results. Good. So it's not how old you are that determines success, it's how old your knee is.
I see. Now, the thing is, your cells in your body, as you get older, they don't reproduce so much, do they? And this is why the stem cell can help.
Yeah. It's not so much the cells. What it is access of those cells to growth factors. So your cells are sitting there in your bone or in your cartilage or in the fat, and they're actually ready to go, but they just don't get the message to divide. What we are doing with the PRP and the stem cells is activating the cells that are already there but have been lying dormant. So it's your own cells that we use. We don't put anybody else's cells in, but we activate them, and we activate them by delivering growth factors.
And PRP stands for what?
PRP is platelet-rich plasma. In both cases, what we're doing is called autologous treatment, which means we're using your own blood cells or we're using your own fat, and we put it into the area where the blood supply isn't so good, such as in the knee, where the cartilage, it could recover if it received growth factors, but because there's no really rich blood supply to the knee or to some of the tendons, we have to help it along.
Right. How did you get involved in all this? This is quite an interesting field, isn't it?
Yeah, well, I think I was very lucky to be introduced to it in its early days, in its infancy. And I think I'm the first doctor to really go, wow, this is the most exciting thing since penicillin. Wow. And I've committed myself now to only doing PRP and stem cell regenerative treatment. I used to be a very busy sports doctor, specialising in martial arts injuries and boxing and treating a lot of the fighters. And I still do treat them, but now instead of sticking cortisone in and giving them anti-inflammatories, I use the PRP. And I think that's a lot healthier.
Well, it's natural, isn't it?
Exactly. It's natural, it's much safer. And although the results are not as quick as with cortisone, they're much more long-term. Yeah.
Now this place here, I mean, it's a wonderful building, and you've got some fantastic facilities. Let's go and look at some of them, shall we?
Sure, I'd like that.
We're in the hyperbaric chamber room, and explain, what is a hyperbaric chamber?
Okay, it's a high-pressure oxygen chamber. We like the patients prior to treatment to go into the hyperbaric chamber. It helps to release some of the stem cells that are present in the bone marrow into the peripheral blood. Of course, we take that peripheral blood and then we use it to generate our platelet-rich plasma, which we inject into the damaged area. It has more stem cells in it after they've had a hyperbaric treatment.
Yeah. Looks a bit like it could be a bit claustrophobic in there.
Yes, claustrophobic people don't enjoy that, of course.
No.
But most people actually find it very relaxing.
Yeah?
Yeah.
And it's all safe, let's face it.
Yes, and it's good for jet lag.
So then we go into the operating theatre. Oh, and this is one of your operating rooms, isn't it?
That's right, yes.
And with your team of doctors.
That's right. Dr. Gibb and Dr. Siddhichai.
Hello.
Dr. Gibb specialises in doing our cosmetic work, and Dr. Siddhichai is an orthopaedic surgeon.
Right.
And he and I have been working together to develop really high standards of stem cell orthopaedics. And even just an hour ago, we did a stem cell biopsy in this room.
Wow. And how do you do that?
We take fat from the patient's tummy, and it's not that hard. It's similar to the cosmetic liposuctions, but we take a much smaller volume, so there is nowhere near as much discomfort afterwards.
Okay, and from there, what do you do after that? You analyse it, I suppose.
Yes, it goes through to the laboratory, and in the laboratory we separate out all the fluids that we used in the extraction process, and then we combine platelet-rich plasma with the fat and stem cells, and then activate it with our light boxes.
Right.
To activate the stem cells.
Okay. Let's go and see some other areas of this wonderful place. I mean, fantastic facility.
Yes, thank you very much.
Well, we're here with an actual patient, and what kind of people actually need to have stem cell treatment?
Most of our patients have osteoarthritis of the knee. We also do osteoarthritis of the hip and the other smaller joints as well. And we get a wide variety of people. This weekend we've had people from Dubai, Burma, Bangladesh, Thailand, Australia, China, all coming to the clinic. But we also treat people from Thailand, and we treat all socioeconomic groups right through from the elite high society right through to there's some charity cases that we treat.
So what would actually happen in this case then with these knees?
Well, what we'll do is we've already aspirated the fat, and the stem cells have been made in the laboratory, and shortly Dr. Siddhichai will be injecting the stem cells into the knee joint.
Right, okay. Well, let's leave the doctor in peace and let him get on with his work. Very good work. And we'll go and have a look at another area of the... is it a hospital?
Yeah, clinic.
Clinic.
Yes, medical centre. Yeah.
Medical centre. We're here in the cosmetic treatment room now, and some people need it more than others. What's your name?
Wrinkly Megan.
Wrinkly Megan, right. So obviously she needs a fair bit of work doing. What kind of treatments are the most common?
Right. We have the two alternatives. We have the traditional, such as Botox and fillers, and we have PRP, platelet-rich plasma, which is also known as the vampire facials. Which, it's become very popular in Hollywood, and it's a way of rejuvenating the skin naturally.
Yeah.
So for some people, they want the fast results from Botox. Others want to use a more natural alternative, and PRP is available for those.
Yeah. And it's a much more natural way of doing it than Botox.
That's right. It's a non-toxic natural substance from your own body.
Yeah. And you're a cosmetologist?
Yes. Dr. Gibb.
Swaddy Cup.
สวัสดีค่ะ
And what's kind of length of time would somebody need to be here?
Look, for the cosmetic PRP treatment, you have to take the blood. So usually it's about an hour and a half from when they arrive to when they leave. And we don't just do the girls as well, we can do the men, not just for the face but also the hairline.
Now, I did notice, actually, you've got a little bit of regrowth there.
That's right. Pretty happy about that.
You're a walking example of it, are you?
That's right, yes.
So what have you had done?
I've had my forehead and the bald patch at the back treated, and I feel not only have I had a bit of regrowth, but I think the colour, it's not so grey as it used to be.
No.
Yeah.
Right. Looks good. It's growing back well.
Yeah, I'm happy with that. The bioscan is a great screening device to pick up health problems that our patients may have, because much as we enjoy sticking needles in people, regenerative medicine is more than just the stem cells or the PRP. It's really getting to know a patient and giving them advice about how they can help themselves to heal. So we look at diet, exercise, lifestyle and weight loss, and all sorts of supplements and or deficiencies that the patient may be also aided by. So we end up, a lot of our patients, not only pain-free, but also healthier. A lot of our patients will lose 5 kilos during the process of their treatment because we've encouraged them to exercise sensibly and cut out sugars and other processed foods in their diet. The BioScan is a screening device, which means it won't give us a specific diagnosis, but it will alert us to where the body isn't working properly. And then with other tests, such as an ECG or blood tests, for example, for prostate screening, we can actually follow up and ensure whether the patient is in good health or needs further treatment.
Well, Peter, it's really fascinating seeing your place in action. And what would you say to anybody who has got a problem? It doesn't have to just be cosmetic, is it?
No, osteoarthritic knees are our most commonly treated condition. And what I'd say is, look, with PRP or stem cells, if we don't fix you, you can still go on to have the joint replacement surgery. But we're a non-surgical alternative. And the worst case scenario is that we give you back to the surgeon that you're originally going to see. But in the best instance, we can either delay or in fact obviate the need for surgery.
So price-wise, I mean, it's going to save you a lot of money, really, if you can get this done and you don't have to have that kind of replacement.
Yes, and what's really good about the PRP treatment is you can walk in and walk out.
Right.
So that you can go to work. You don't have to have 3 months off to recuperate. And for a lot of people, that's important. And also, we don't have side effects that you might see with surgery, such as the infection or the deep vein thrombosis.
Yeah.
In fact, in Australia now, they're reconsidering the entire issue of insurance rebates for arthroscopes because there's so many health problems come from the arthroscopies.
And just finally, how can people get in touch with you?
Right. The best thing is to go to the surecell.com website, or come here to the clinic in Pratamnak on Soy 6, or give us a call.
Fantastic. Thanks very much. It's really fascinating. And how about that? It's right here in the middle of Pattaya. Fantastic.